Are we ready? All right. Craig Barnes, would you help us in doing the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. Welcome to the October 14th Board of County Commissioners for Shawnee County. On my right is Commissioner Kevin Cook representing District 2, and on my left is Commissioner Aaron Mays representing District 3. I'm Bill Rippon, and I represent District 1. Okay, first thing on the agenda.
Proclamations, presentations. Number 1, Community Health Improvement Plan, Susan Kamen, Health Department.
Good morning, Commissioners. Susan Kamen, Community Health Planner, Shawnee County Health Department. I wanted to first thank you for your time today to discuss the Community Health Improvement Plan. As you know, health is influenced by many different factors. If you look at the center of the half circle here, there are individual factors that influence our health, such as our age, our genetic history of different conditions. But research shows that as we move out of the circle, there are broader socioeconomic, cultural, and environmental conditions in our community that more greatly influence our community's health. And these are things such as education, housing, safe neighborhoods, and employment and the economy. If you think back to our Montgomery trip, these are things that we discussed there in relation to economic development and quality of place, which are factors that greatly contribute to both those aspects and also for building healthy, thriving, and vibrant communities. Which is why having a coordinated and action-driven plan to address our community's health improvement processes is crucial, and I am excited to announce that Shawnee County has completed their improvement plan for 2020 to 2022. And you can think of this plan much like an economic development plan, which will require a lot of engagement from community and a lot of intentional efforts over a long period of time to see positive changes in long-term health outcomes. So just to provide a refresher on what a community health improvement plan is, it is a systematic roadmap that describes how a community will address health priorities identified through a community health assessment. And for us, that assessment was completed in 2018, and it involved a series of survey collection, which we received over 2,000 responses, as well as qualitative data collection through focus groups and interviews, which provided a lot of that context and lived experiences from our community members. And so a key aspect of this process, like I said, is that it is both data-driven and community-driven, and I think that's important to remember when we're talking about outcomes, because it's both what the data says, but also what our community's perceptions and opinions of the health issues are. This plan also establishes goals and objective measures of change to track progress over time, and an important aspect is that it identifies community partners for accountability in the process and lays out intervention strategies for action to move progress on the priority areas. And so for this plan, our 4 priority areas are shown here. We have behavioral health, substance use, access to food, and health equity. Behavioral health, specifically, we're looking at suicide prevention and working with our behavioral health partners in thinking through what an integrated systems of care might look like. And this would involve anything from streamlining referrals to access to services when it comes to mental health. Then we have access to food, which relates to food insecurity and food deserts in our community. Food insecurity meaning those populations that are both low income and low access to foods. And then food deserts are those census tracts that are designated as food deserts by the USDA in our county. And then we have substance use, which there's a lot of crossover between behavioral health and substance use, but we decided based on the information that we gathered to separate the two because we're focusing specifically on youth as it relates to substance use, specifically looking at vaping and binge drinking among our youth. And then lastly, we have health equity, which by definition, health equity is the just and fair opportunity for everyone in our community to have a healthy and prosperous life. And under this priority area, we're looking at maternal, infant, and child health, obesity, and sexually transmitted infections. Because when you look at the breakdown of the data under these priority areas, you'll find that racial and ethnic minorities are disproportionately affected. And so we're looking at it from this health equity lens to see if we can tailor some of our strategies to those populations. So in front of you, you have the plan, and we're working on getting nicer binded copies for you guys in the community. But if you were to look at these priority areas in the plan, you'll see that each of them have specific goals and objective measures to track progress over time. And you'll find initial intervention strategies, which we've identified with our community partners for year one. And then internally, we'll have action plans with specific action steps that will guide the work moving forward. So since health is influenced by so many different factors, it is crucial that we engage different sectors of the community and just the community at large. And so we've created a CHIP steering committee, which right now encompasses the health department, Stormont Vale Health, and Heartland Healthy Neighborhoods leadership, but we have plans to expand that steering committee as implementation moves forward with further representation from the community. Heartland Healthy Neighborhoods is our Grassroots Community Health Coalition, and they've served as a lead convener for this work in our community, and the group has involvement from over 60 community organizations and groups, and even some committed volunteers from the community who are just representing themselves. Additionally, we've garnered engagement from our other community organizations that weren't already involved with Heartland Healthy Neighborhoods, but had specific content expertise in some of the priority areas, such as substance use and behavioral health. And so this is, I know it might be hard to see, but a breakdown of everyone who's involved in this work thus far. There's our main Heartland Healthy Neighborhoods work groups in a center, and then outside we have our partnering organizations, and then even some new forming groups who will think critically about behavioral health and STIs in our community. And this is also the very last page in the plan. So ultimately the impact of the CHIP process is that it strives to build community capacity by enhancing collaboration so that we're better equipped as a community to address health priorities as they come now and in the future. And it does this by establishing partnerships and collaborations, and not only that, but also aligning our community's goals so that we're working together rather than in parallel pathways, and then we can leverage our resources and our expertise in different areas that impact health to maximize our collective impact. So as far as the next steps, here's a timeline of the process. So we have a completed plan with initial strategies for year one, and the next steps are to create those action plans, and then into 2020 to 2022 we'll revisit the action plans and create new ones as needed, and start with implementation and quarterly reporting on progress in the CHIP. And we're looking at different ways to do reporting, such as public-facing dashboards that we can access online, or different infographics, things that will be easy to digest for the community and people. And then an important aspect is to that evaluation and community capacity is ongoing, and this is key in any process, and especially this one because we do need a lot of engagement from community. And so this concludes my presentation for today. I do have Craig Barnes with me, who is a current chair of Heartland Healthy Neighborhoods, and we would be happy to answer any questions about the plan.
Susan, you haven't been here a long time, but you've had a big impact in getting this put together and working as the community health planner.
Thank you, Commissioner.
Where do you see the best way to collaborate? I mean, we can't do this by ourselves. We need help from the city, the state, from the school districts. What's the best way you see for us to be able to collaborate and address these things, these issues from the community health standpoint in the school districts, on a city level, on a state level?
That's a great question. I hope that this plan is a foundation for the start of those collaborations, that now we're able to show that there have been some thoughts and some strategies laid out, some initial steps, and some opportunities for engagement with sectors that maybe haven't been involved in the past. So I hope that this plan serves as an opportunity for them to sort of see where they fit in the big picture of health, and that they engage in the work moving forward, because it will take, like you said, our entire community to move community health.
I mean, I think it's going to be essential for us to really tap into, like, starting with the school districts and
Absolutely.
working with childhood obesity and that level, healthy lifestyles, and then working with the parents and all the way from the city. And I know that Commissioner Mays may have some ideas on ways the city might be able to interact with that. I mean, I know it's one of his keystones is working with collaboration.
Yeah, and we would love that engagement from everyone. And I think I'm new to the community, but I do see the momentum, and that Topeka and Shawnee County, we have hardworking and very passionate people, so I feel confident in that we'll be able to find that engagement from our broad community. So.
Thank you.
Commissioner Mays? Nothing. Susan, you talked about in your CHIP plan, you identified some partners. What about in smaller communities? Do you have partnerships with, like, say, Auburn and Silver Lake, Rossville?
We do, and actually they were involved in the assessment process, so we actually held some focus groups there, and were able to get some interesting insight from their experiences in sort of the smaller communities in our county. As far as involvement moving forward, Craig, do you have some thoughts around that? I know.
Craig Barnes, Division Manager, the Health Department, and then Chair, Heartland Health Neighborhoods. To Susan's point, one of the exciting things that we did for the first time this year was we held focus groups in the outlying communities. This was specifically to get their perceptions of what their health needs were, and not have someone from inside the city of Topeka kind of making a presumption as to what their health needs were. From there, to your point about the school districts, Commissioner Cook, that is one thing that we're truly working on right now, is engaging the school districts on the areas specifically around vaping right now, and childhood obesity, healthy access to food. Those are big issues that are outlined here in the CHIP, and getting the school districts engaged primarily is a key facet for moving these forward. So we're looking specifically at hosting more listening sessions and focus groups and going to the community. That's a big piece of this plan moving forward, is to try to get more feedback, ongoing evaluation from the community members as we do this, so that we make sure that the interventions and the strategies that we're working on are truly to the benefit of our community. So you'll see us a lot more out and about more in those areas. And if you have any contacts or any groups that you think would be beneficial in those outside districts, Tecumseh, Silver Lake, Rossville, Auburn, we'd be more than happy to reach out to them and see if there's a way that we can engage them moving forward. So,
Thank you.
Okay, thank you. Susan, I'd like to thank you for all the effort you put into this, and staff. I know Craig was involved, and Linda Oaks, and I appreciate all the work you've put into this report.
Thank you, Commissioner Rippon. I
Okay,
appreciate it.
thank you very much.
Thank you, Commissioners.
Next item.
Item 3, consent agenda.
I move for approval as presented.
Second.
Motion has been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,415,681.20. The highlights out of the voucher report really broke into 4 different areas. One, we have our Capers account, $337,126. Under allocations, we have $491,878. Those are to charitable organizations we have in the community. Health insurance for our employees of $119,388. And then finally, the Parks and Recreation is $112,387. Under general expense, I would note that we do have the repair for interstate elevator. This is for the North Annex elevator that we repaired. But I do not have any questions regarding the vouchers, and would move for their approval.
Second.
Motion has been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Opposed? Motion carries 3-0. Next one.
Number 2, consider correction orders.
I move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon to approve correction orders, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B, Health Department. Number 1, consider approval of request to seek bids for a four-wheel drive vehicle to fulfill the duties of the staff in the Health Protection Division working in the on-site wastewater program, as well as other duties such as nuisance complaints and checking quarantine animals, with a budgeted amount of $27,000 and funding from the tax allocation and fees from the 2019 budget.
Morning, Commissioners. Craig Barnes, Health Department. As it was mentioned, we're seeking approval to seek bids for a four-wheel drive vehicle. This will be used in our environmental health program for the areas of like on-site wastewater program, nuisance complaints, and checking quarantine animals. Frequently, our staff have to drive through muddy conditions and terrain. Our health protection manager has routinely had to use his personal vehicle in those conditions. And so this was put into the 2019 budget. It was approved by the Board of County Commissioners at that time, and we are just seeking approval for that. If you have any questions, I'd be more than happy to answer them.
Questions?
No.
I'll move for approval.
One second.
Motion has been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you very much.
Next item.
Item C, Counselor. Number 1, removal and replacement of unstable subgrade and a gas regulator boiler vent piping for the Stormontville Event Center renovations project at a cost of $82,738 with funding from the contingency fund.
Good morning, Commissioners. Ashley Biegert, Assistant County Counselor. This request is for approval of a change order to the contract for the Event Center renovations. It covers the 3 items as the clerk indicated. The utility improvements on the west side related to Western Avenue are required by the City of Topeka. They're going to remove and replace unstable subgrade on the southeast side where the new temporary entrance is being put in, and then there's boiler vent piping that's being required by the state fire marshal. None of these items are anticipated to extend the substantial completion date. If you have any questions, I'd be happy to try to answer them, and Kellen Seitz is also here.
I don't have any questions today.
I'll move to approve.
Second.
Okay. Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Opposed, motion carries 3-0.
Thank you.
Next item.
Item D, Corrections. Number 1, consider approval of request to authorize an emergency expenditure of $6,360.79 for repair of an elevator in the Adult Detention Center with funding from the agency budget.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. This is a request to repair, an emergency request to repair an elevator that went down. The overall engine that runs the elevator went down and oil had spilled out all over the floor, which it initially caused some bad smoke. We did get that contained. There was no damage or anything like that. This started in August, and we immediately met with Betty regarding this because there were several steps that we had to take during this. One of them is they had to take the motor out of the engine room. They had to take it out, bake all of the burnt substance off. They took it out, and then they tried to repair it, and then they were going to once they did that, they brought it back into the jail and then determined what else was damaged. So this has taken a considerable amount of time. We do have alternate routes in the facility, but this was something that we do use every day. This is a transport elevator for our inmates, our food carts, and things like that. I did speak with Betty. We do have the money in our budget to take care of these things. These were sole source providers, which we did at the very beginning. We worked with Betty on those there. So the elevator is up and running, and we're back to normal operations, and I'll be happy to answer any questions you may have.
Questions?
I don't have anything.
I don't either.
I move that we approve.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Opposed, motion carries 3-0. Next item.
Number 2, consider approval of request for one employee to attend the Nebraska Law Enforcement Hiring Expo in Omaha, Nebraska, at a cost of approximately $600 with funding from the detention budget.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. I don't think it's any secret, I've talked to each commissioner regarding that, the ongoing challenges that we do have with staffing. And you know, as I've indicated, staffing in corrections, or the field of corrections or law enforcement across the United States is very tough. We do attend several career fairs. That a lot of times it's kind of hit and miss on some career fairs, but this career fair, when I met with Angela Lewis, Director of Human Resource, is dedicated strictly to law enforcement and corrections. We have done some research. We found out that our staff are willing to travel and to relocate and to be mobile, and so we do feel that this would be an adequate and a good resource for us to attend. Again, I did meet with Angela regarding this. She felt the same way I did, being it was specifically targeted for law enforcement corrections. I did meet with our training staff, and those who do go to career fairs, they felt the same way with this being not just a generic career fair, that it being strictly identified and to focus in on law enforcement corrections, that we thought that this would be beneficial. We do have a staff member that would be going. This person has well over 15 years of experience. She is over our human resource area at the jail and does an excellent job, and so she would be the one that would be taking all her stuff, staying the night before because they want to set up the night before, and then we'll be able to go that day. And I'd be happy to, we have the money in our account, and I did talk to Angela, and so I would ask if you have any questions, please let me know.
It's a great opportunity. I'll move for approval.
I will second that. Motion made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. All opposed, motion carries 3-0.
Thank you very much.
Next item.
Item E, Commission, number 1, consider appointment of a voting delegate and alternates for the 44th Annual KAC Conference to be held November 12th, 13th, and 14th, 2019.
Mr. Chairman? Yes. Typically, we would have a delegate and an alternate at the Kansas Association of Counties annual meeting. I don't believe that any of the county commissioners are going this year, but oh, you are?
I can go.
Okay, then I would nominate you as the voting delegate, and then the counselor is usually there as well, and I would have the counselor as the alternate.
Second?
Okay, looks like I'm there.
Congratulations.
Motion made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. All opposed, motion carries 3-0. Next.
Administrative Communications.
Okay. Take this opportunity for anyone to speak about any subject.
Good morning, Commissioners. Jeremy Myers, Shawnee County Parks and Recreation. I don't want to just sit there, but we have a public engagement meeting scheduled for Tuesday, October 22nd at 6 p.m. at the Major Palm Park. That's at 1815 Southwest 37th Street here in Topeka. We're looking for public to give us ideas on what we can do with Major Palm. We also do this with several of our parks, and we'll be having some more scheduled throughout the year as well, too. So, tulips are arriving tomorrow. I know we're all excited to get our fingers dirty and start planting tulips in the next couple of weeks, so I invite you guys and some other city departments to help out with that. We do have our staff getting the planting beds ready in our parks, Ted Ensley Gardens, Gage Park, and the Ward Mead Park. Ted Ensley Gardens, we have October 21st, 22nd, 23rd from 9 to noon. You don't have to be there the whole time. We encourage you to just come in and plant for an hour if you can. At Gage Park, October 28th, 29th, and 30th from 9 to noon. Those are Monday, Tuesday, and Wednesdays. So we're really looking forward to the public to get engaged and get involved with our Tulip Time. We just started a Tulip Time committee with some members of our friends groups, Go Topeka, and our staff as well. So we are planning next year's Tulip Time and looking for future Tulip Time events too. So, and last thing I have is the Lake Shawnee trout stocking. That'll be Saturday, October 26th at noon at the main boat ramp at Lake Shawnee. That's on the north end of Lake Shawnee. We partner with the Kansas Department of Wildlife, Parks and Tourism on this project. The lake will be closed for fishing October 26th through November 2nd. So give those trout a chance to see their new home and find areas around the lake. So do you have any questions for me at all?
I might just add, I did a master plan for Major Palm Park. It might give you guys a starting point for your public involvement there and public input. I'll get it to you. Only I probably can find it.
Appreciate that.
I had a unique filing system. Everything was like A, B, and 3, so.
Nice, nice.
I will find that for you.
Great.
Thank you very much.
Thank you.
Good morning, Commissioners. Dustin Nichols, Emergency Management. It's that time of year where we're starting to see some cooler temperatures. People like to put the hoodies on and go out and sit around the fire pits and all that good stuff. It's also the same time of year where we get a little dry and fires can take off on us as we're seeing on the West Coast. So just put a reminder out there that if you're going to do burn pits, anything like that, please monitor them, have a fire extinguisher nearby, and don't let them get out of control, and enjoy your night. And everybody else can too. So thanks.
Thank you very much.
All right, I couldn't let you guys get away without one more comment for the calendar year on mosquitoes. So we have officially finished our mosquito surveillance season last Friday. And so we will be compiling a report for the data that we received this year and then be submitting it to you all as the commissioners, as well as our outlying communities where we had traps as well. So I wanted to give you a heads up that that has finished. With that, that means we have now segued into flu surveillance season. So I just want to take the opportunity to engage tell the public and everyone here, if they haven't gotten their flu shot already, go ahead and do so. So, thank you very much.
Thank you very much. Anyone else? Commissioner Cook?
No, I have nothing today. Thank you.
Commissioner Mays?
Nor do I.
Either. All right, well, thank you, everybody, and I think we're adjourned.
Next.
Executive sessions?
Oh, sorry. Do we have a need for executive session? No. Then we're adjourned. Thank you.
Major Paul.
Major Paul, I remember